child who has been in 2 very traumatic wound injuries. And there were ambulance rides and scary surgeries and all of that, but we were always the next day back to our activities as a family. If I were a mom here and Bibi were my same child here, we probably wouldn't have made it to the hospital in time or never left the hospital, that Bibi wouldn't have survived her same accidents here. It was humbling. Hard to say as a mom. My name is Mika Frechette, and I'm from Fairfield County, Greenwich, Connecticut.
If we look at Sierra Leone, it's always been ranked as a country when we have the highest number of maternal and child deaths.
I came on this trip primarily because I'm so skeptical and cynical when I hear numbers, and when I heard about the mortality rate for moms in Sierra Leone, my cynical mind thought there must be some type of error in how we collect numbers.
One of the reasons is early marriage or teenage pregnancy. One, this child was not properly prepared to have a baby, and then that child has to have the baby to deliver at home. That compounds it. So the slightest complication that comes in, that child or that mother now would likely die.
After giving birth, the placenta was stuck. They tried harder and harder, but they couldn't remove it. They called the medical office for an ambulance. When we came to the health center, the doctor removed it. If the ambulance wouldn't have come, I would have died.
If our mother survived, the chances of the children surviving are also high. But so for national development, for long time, for future development of our country, it really lies being in the health and the well-being of our women and children.
We try to encourage the mothers to come to the health centers or the hospital to utilize the hospital. They don't believe in the modern medicine. They only believe in the traditional medicine.
They don't believe in birth spacing. They believe in giving birth to all the children in their womb. That's the normal, what they think.
Yeah, we are really encouraging the religious leaders to come so that once the teaching is going on, they can really understand exactly the importance of all these family planning methods.
Yeah, the mortality rate was secret in our community because of lacking of the knowledge. So now World Vision came in and teach people how to take care of your child, your family planning. You cannot just born like that. You have to plan yourself.
I think it's incredibly important, imperative even for a faith-based organization to be involved in family planning, having 4 children. I cannot be a good mom if I have my children requiring all of me at the same time.
And with a very good planning, your children will be proper children, and they will love you. But if you don't have a food for your children, no education, at the end of the day, they used to go to the street and they be your enemy and also that community.
The community health workers visit, carry behavior change messages at the household level.
And by the utilization of these family planning methods, we are not receiving as much as these cases that we are receiving in the centers.
I'm a very hardworking farmer. As you can see, I'm just coming back from my land. The little I have, I bring back so that my wife can eat a balanced diet and produce more milk for the baby.
I think that for an organization to make sure that the women have the education and the tools to make those choices for themselves so that they can fully experience the joy of being a mom and the joy of knowing that you've been able to do a good job as a mom is a gift to give every mom.
The future of a nation, it really depends on its young population, including children. If every child has high possibility of dying before their 5th birthday, then you understand that soon we'll have a very weak population with its children dying more often than not. We will not have the human resource required to develop our country, and then we will be reliant and dependent upon foreign aid and foreign support for the next generation.
Sierra Leone is ripe for development. Sierra Leone is ripe to come and work with the people and the children, especially for the children. And then because of the war, the supporting mechanisms were lost. We need to get those back. We need to get proper health facilities available. We need to have other infrastructure that will help those children to achieve life in all its fullness.